Common injuries in rowers on the elite level are predominantly low back injuries and rib stress fractures. In order to break a rib, you have to pull hard and repetitively over months. And we see that occasionally in high school athletes, a little more commonly in collegiate athletes, and much more commonly in the elite athletes, particularly in the wintertime when they're training at the training center in Chula Vista, where the weather is nice and the water is good and the hours are long of training. Some of the injuries that rowers get can't be prevented. When they're training at an elite level to try and win a world championships or an Olympic Games, the volume of training is enormous. And what one athlete may be able to get through in terms of volume of training, another athlete may be more prone to injury at that same volume of training. So we can't prevent all of the injuries, particularly the low back and the rib injuries. We can have them work on their core stability, which helps the low back injuries, but there are some athletes that are going to get hurt regardless of doing all the right things. And the goal is actually to diagnose the injury early, shut them down for a shorter period of time, rather than have them continue to row through an injury. Because rowers are unique in that the rowing event itself is very painful. The last 2 minutes of a rowing race is extraordinarily painful because of lactic acid buildup in the muscle. So these elite athletes are used to rowing in pretty intense pain, and trying to teach them the normal pain at the end of a race versus the pain from an injury is sometimes hard until they've had an injury and they've learned how to get through that.
When you sit, you have the highest loads in the spine, and rowers are seated in a position a little bit more, that loads the disc a little bit more than in a cyclist. But a rower rows across their lumbar spine, and so that's the number one injury that you see in rowers. They tend to have back problems, they tend to have disc injuries, they'll lose range of motion in their back, they'll be unable to row on their ergometer because of the discomfort. So we'll know pretty soon. In tandem with that, or separate, is hip injuries. It requires you to come into a flex position and rotate over one of your hips if you're doing sweep rowing, and their sculling will come straight up. And some sweep rowers will have a reduced amount of rotation on the side that they rotate to, and that will put a little torque on their back. So looking at those two things, hip impingement, we see a tremendous amount of rowers with that, and back pain. It's basically what I do a lot of and see a lot of is these rowers.